My advocacy began with a poem. The doctor said, "Chanel, have you ever heard of lupus?" Well, a few months later, my body, it made me rest. Because lupus is a disease that flares up in times of stress, and I was constantly pushing it as if fighting my humanness. Well, this machine, it broke down. But see, it put things in perspective. So I vowed to live every day as if I have 24 hours left. Value your health and love life. I had to believe in me. Can't you see? Lupus can't hold me. Because me loving myself, well, that's the beginning of my testimony. When I was diagnosed, I didn't tell anyone really. But one day I wrote a poem kind of encouraging myself that I should live life to the fullest even with this illness. I decided to share it at a poetry night one day, and so many people came up to me afterwards and said, "Oh my gosh, I have lupus. My friend has lupus. My mom has lupus. I think I have lupus." And that made me see the need for more people to talk about this illness because there's so much that happens that gets overlooked in different communities. And that's how we make the right change that we need to see. Navigating the health system as a person of color is a challenge in itself. Everything from, just not having your pain or your symptoms taken seriously, or people not believing you're in as much pain as you're in. In communities that I grew up in, when I first was diagnosed, it took forever to get a doctor's appointment. These different things that impact quality of care are very, very real. A vast majority of drugs are tried first in white males. That doesn't factor in our hormones. Our bodies all operate different ways. I enrolled in a clinical trial because at the time there were no medications for people living with lupus. At the time, it was just taking whatever was given to you. You kind of got a list of side effects to look for all these different things and sent on your way. And the idea that there was hope to have something that could really, really specifically manage my lupus, that was something I felt the need to really take seriously and to give it my all and see what could happen. At first I said no, because I know the history of clinical trials in people of color, the history of research, with different populations, and it was scary to me. But the more I learned about what that trial process is, what rules and regulations have been implemented, it made me feel a lot more secure, a lot more confident as women of color. It is important that we are included in these conversations around our health. We want to make sure we're counted. We want to make sure that we leave behind something that can treat people in our community that might have to deal with this disease. Living with lupus is the reason I am an artist. I really thought about, forbid I get stuck in a hospital. What have I not done? What have I not given my all to? And it made me say, hey, I'm gonna pour into this creative side of me that I really love. Living your life to the fullest, whatever that is what really led me to still, being able to smile and still live a really, really amazing life.